This is Dr. Paul Thomlinson from Compass Health Network, and this is our podcast aimed at inspiring hope and promoting wellness. Here we try to offer listeners a better understanding of some of the challenges of these times we're living in and living through. An understanding built on insights from research in the social, behavioral, and health sciences, as well as from stories of lived experience. The bottom line is we need to find and apply the best evidence we can so that we can know, do, and be better and better. So this episode is tied to September as Suicide Prevention Month. I won't spend a lot of time trying to convince you of why this is such a crucial subject and why we're so concerned about finding ways and means to prevent people from dying needless and tragic deaths by suicide. But just keep in mind that we're losing what equates to about a good-sized commercial airliner full of people every single day in this country to suicide, and that it's one of the most preventable of all causes of death. We've learned a lot about suicide from research and experience in recent years, and I'm always interested in how thinking changes, evolves, and gets more informed over time. So I found myself with a golden opportunity to talk to some friends and colleagues who are experts in the field of suicide prevention. Folks who've devoted a good portion of their professional and personal lives to the cause. I was fortunate to be at a gathering of such folks at the Missouri Foundation for Health Grantees meeting last week in St. Louis. So I pulled 4 of them aside to ask the question, how has your thinking about suicide changed over time? For example, are there things you used to think that you no longer do, or what's an important lesson you've learned about suicide recently? I asked these questions of the one and only Dr. Bart Andrews of Behavioral Health Response, Chris Davis of Community Partnership of the Ozarks, Katie Ellison of Missouri Institute of Mental Health, and Compass's own Ethan Newman. I'd like to share some of our conversations about how we've changed our minds about suicide and how to prevent it. Let's start with Dr. Bart Andrews of Behavioral Health Response.
Things that have changed for me is I strongly believe now that we have a much better chance of preventing suicide when we do much more collaborative interventions. When we, instead of focusing so much on means at the beginning of the intervention, let's focus on what's driving suicide. Let's actually validate that the person has legitimate reasons for killing themselves. I think this scares clinicians, but people have very valid reasons about why they want to kill themselves.
Yes.
And we acknowledge that, and we acknowledge how bad things are, we create relief. Second, I think that one of the things that we need to do, and I believe strongly, is that we need to directly address the drivers of suicide. What are the pain points? What can we do about those? And the goal is really short term. What can we do short term to keep you safe for now, right? It's really that living works assist mindset of let's work. The thing I've learned the most about suicide prevention is we're buying a little more time. Right? Most people, most of the time, if you can keep them safe during the height of their crisis, will live out the rest of their lives and suicide won't be an issue for them, right?
Right, exactly.
So that's a key thing. Finally, the biggest change is I used to be an internal kind of, the idea that psychopathology was something inside the person. I have dropped that. I believe that culture and environment explain the bulk of what we call psychiatric conditions, with a few exceptions. And even those that have strong genetic predispositions, culture and environment drive the expression and the severity.
Yeah, I remember you had a post recently that said, I think, hey, housing is suicide prevention. Getting people jobs is suicide prevention. Anything that helps them find meaning and purpose and takes care of those basic fundamental needs and so forth. So your top of mind is always deeper than anybody else's bottom. So thanks so much for that. And it may be a dumb question, but I'd like to just close real quick with, that's a lot that's changed over time for you and your thinking, obviously. You continue to evolve and change. What caused it?
Lots of different things. I'm getting trained in ASSIST, applied suicide intervention skills training. Dr. Thomas Joyner's books. If you haven't read it, he changed so much of my thinking about suicide. In particular, one of the biggest things I used to think that suicide was kind of a sense of weakness. And I'm a suicide attempt survivor.
Right.
And actually it turns out that people that are stronger, that tolerate physical pain better, are more likely to kill themselves. So there's a lot of things about suicide that I used to think that, and culturally we still think that just don't add up, that don't make sense. So Why People Die of Suicide and Suicide Myths by Dr. Thomas Joyner, must reads, beautifully written, highly accessible to any reader.
All right, there's just like nobody else who's got like the lived experience, clinical and research, I'm bringing together like he's got. I'm a big fan too. So, hey, thanks Bart, I appreciate it.
Always appreciate talking to you.
So you heard Dr. Andrews talking about many ways the field has changed in his career so far, and he highlighted the importance of having honest, sometimes terrifying conversations with people about the legitimate reasons they have for wanting to die, and the fact that it should be a collaborative exercise, working together to identify the reasons for wanting to leave, and the countervailing reasons to keep on going, to keep on living. Also, just to reiterate, he talked about the importance of keeping people safe during suicidal crises, which are very often short-lived and which may never return once they're past, as well as the incredibly powerful influence of the environment on mental health and suicide. And with Bart in particular, I asked about what contributed most to changes in his thinking, and here we have something else major in common. Both of us have been heavily influenced by the books of Dr. Thomas Joyner, Why People Die by Suicide and Myths of Suicide. Paradoxically, as Bart points out, it may be people who are strongest in some ways that are most likely to die by suicide. It's not a sign of weakness. Now think about that for a moment. Suicide is complicated. Next, we hear from my old friend, Chris Davis from Community Partnership of the Ozarks.
Thanks for asking me, Paul. I appreciate that. One of the things is that language matters. How we say things makes a big difference. And my thinking on that has changed over the last few years. A lot of us have grown up hearing words like committing suicide and successful suicide and things like that. And I've learned how that actually can perpetuate the stigma related to suicide and put myths out there. When we think about successful something, tying it to a tragedy like suicide is confusing and doesn't really put it where it is. We want to complete, we want to be successful, but we don't want that for suicide. So
Absolutely.
Changing it to dying by suicide and
Yes.
so forth.
Yeah. I always think about, I just did a post a moment ago where I used the very conscious choice of, if you're thinking about killing yourself, which is very direct language. And so I think thinking about the importance of our language, that could be jarring to some people, but that's really exactly kind of what we want to do in some ways. Don't sugarcoat it, don't pussyfoot around, don't beat around the mulberry bush. Yeah. Are you thinking about killing yourself? Are you thinking about dying by suicide, you know?
And not are you thinking of hurting yourself.
Right.
You can ask somebody, are you thinking of hurting yourself?
Yeah.
And they can answer you honestly, and 10 seconds later attempt suicide.
Absolutely.
Because in their mind, it could be that they're such a dark place.
Yeah.
The hurt that they feel right then, they can't imagine being any worse. Or they may be thinking, depending on the means, that it's going to happen so quickly that I won't hurt. So
Absolutely.
So not asking, are you thinking of hurting yourself? But like you said,
Could not agree
are you
more.
thinking of killing yourself? Are you thinking of
And I'm hearing that narrative in my head. It's like, no, I'm not thinking about hurting myself. I'm thinking about helping the whole world by taking myself out of it.
Right.
That is the frame of mind of many folks who are in that suicidal frame of mind. Anything else sort of top of mind, if you were to think about the one message in your role, and you're obviously engaged in this every day of your life, what would that be?
If we're alive, there's still hope. So no matter how dark the situation is for the individual, for someone you love, there's always hope for things to get better.
Thank you, brother. No feeling is final except hope. Right?
Yes, sir.
Thank you so much, Chris.
Gosh, I love that guy. You heard what he said, right? Language matters. The way we talk about suicide makes a difference. We should always remember that our words are powerful and they frame our realities. Indeed, they create our realities in many ways, and they perpetuate our realities in the world. Think about that. Commit suicide. What do we commit? Well, commit sins. We commit crimes. And don't you think that makes it harder for people who might be thinking about suicide to talk about it when we talk about it in such ways? Yes, it absolutely does. Next up is the wonderful Katie Ellison from Missouri Institute of Mental Health, from whom I recently took a Suicide Safer Homes training. Listen to what she has to say.
So as a suicide attempt survivor, going back almost to what's today, the 14th?
Yeah.
So 24 years ago today,
Wow.
I attempted suicide to
Wow.
end my life. And so for years after surviving that attempt, I was too embarrassed and ashamed to share that I had ever had the worst day of my entire life. And it was probably about 10 years before I was willing to disclose to trusted peers, colleagues, that I myself had gotten to that point when the question was asked, I don't understand, how could someone get to that point? How could they do something so selfish? And so I disclosed my personal perspective, probably not from a fact base, but my own personal perspective, to just kind of, let's think about this a little bit differently. As my personal journey has evolved, it's that knowledge and understanding and appreciation that those of us who have been there, we can help to save lives by talking about our lived experience and being role models that recovery is possible, that taking care of ourselves, whether that means you take medications for the rest of your life, like me, engaging in mental health counseling, that you don't have to remain in the depths of despair forever and ever.
Cheers to that. This is literally the anniversary today?
Today.
Wow, that's like kismet that I'm talking to you right now.
24 years ago today.
Amazing. Well,
Yeah.
Thanks for sticking around.
Yeah, thanks.
The world's a better place for having you in it.
I'm glad I'm still here. As a professional working in suicide prevention for the past, full-time for the past 10 years, I think the one thing that has changed in the whole narrative and conversation in suicide has been the shift in including the discussion of lethal means,
Yes.
particularly firearms, and not being afraid to touch that third rail. That has to be part of the strategy of having conversations with professionals, with the firearms industry, with mental health and physicians, to gun owners of, let's just elevate your awareness, your understanding. You don't have to be the psychiatrist or the psychologist or the behavioral health professional that journeys with someone who is struggling with despair of, do I live or do I want to die? Or, but if we have a gun in our home, if we choose to be a gun owner in our family, let's have some conversations before we're ever in crisis about how are we going to safely store our firearms. Think about ammunition, so storing them separately. Do we have the adequate means to lock up firearms? Maybe even if we ever get to a point, who would we be comfortable asking to hold on to our firearms for us? Is there a family member or a friend, or to be really willing to have that additional conversation as we grow more confident in how we have these conversations at large about firearms, that it doesn't have to be politically charged or loaded, that it's just about keeping our friend, our neighbor, our family member safer if they ever are faced with the worst day of their life.
Absolutely. I like how you came back to that worst day of your life. Problems have solutions, crises pass, and there are a lot of things we can do from the mental health standpoint, trying to prevent people from getting to the point where they feel like dying. But there's definitely direct, concrete things we can do to make sure that they don't die in the next 15 minutes when they have a gun in front of them or a bottle of pills or whatever. And that's been a revelation for a lot of people, I think, is because it goes against that myth that, hey, once somebody gets in their mind they're going to die by suicide, there's nothing you can do to stop them.
Right.
And if you really believe that, then you don't engage them. Well, I could get it away from them now, but they'll just find another one. And what we know from the research is that's just not true. We can save a life by restricting access to that gun, even for 15 minutes sometimes, or for a few days or whatever. So I really appreciate that. Anything else top of mind? One other thing to share with the listeners about what we can do to keep people from leaving?
Well, we can't, for every person, remove all of the factors and the reasons that contribute to someone having the worst day of their life. Just showing up for people, being connected.
Yeah.
I was alone, I was isolated, geographically isolated, living by myself, isolated. My work situation was isolated. Making that human connection with other people.
Yeah, there's just no substitute for it. There really isn't.
There isn't.
And there's no stronger medicine, especially for suicide prevention, than connecting with other people. When we ask people, what are the sources of hope for you? It's almost always one other person.
Right.
And thank goodness that many of us have that. And for those who don't, we need to figure out ways and means of getting them connected. So.
Yeah.
Thanks, Katie. I appreciate your time.
You're very welcome. Thank you.
Well, there you heard Katie bravely talking about her own journey as a suicide attempt survivor and what it took for her to finally be able to talk about it. And her professional perspective on what's changed is crucial as well. Certainly in the last 10 years, we've become more aware of the importance of lethal means restriction. Simply getting weapons, poisons, other potentially lethal means away from those experiencing a suicidal crisis. It's really about how do we keep them safe when they're faced with the worst day of their life. As Dr. Bart Andrews says, suicide prevention is very often all about just buying some time until the crisis is past. I also love how Katie highlights what I call the medicine of connection in preventing suicide. Let's close with Ethan Newman of Compass sharing his answer to the question of how his thinking has changed about suicide.
First, I want to say that death with suicide is not the goal. The goal for someone that is attempting suicide is to relieve themselves of that pain. And see, this is not an overly complicated concept, but it is a concept that has been misinterpreted by a majority of individuals I interact with. And so if you can understand the reason someone would want to die by suicide, knowing that they don't want to die, they want to live, they just can't find a solution for this pain to relieve it, that death is the only solution they have.
Yeah, I spoke with Bart Andrews, and he says we really need to get to the point where we're more comfortable as clinicians, as behavioral health workers, as advocates, talking about the legitimate reasons people have for dying. It scares us to talk about it, but people have legitimate reasons for wanting to leave the world.
Yes.
And I think to sugarcoat that or to try to live in denial of that doesn't do anyone any good. So
Right.
I appreciate that perspective for sure.
The thing I've learned is majority of people, many of them think, I'm not going to be the one talking to someone about suicide. And the truth is that they are. Majority of the time, people that talk about suicide is with their family, their friends. The idea that they have to talk to them about this, it scares them.
Yes.
Right? And so the one thing I always would say, and especially someone that's listening to this, and they might be thinking, I'm not sure how I could talk to someone about suicide. The odds are in your life you're going to talk to someone. So I mean, the odds are high.
Yes.
The thing to know is that you're asking for them. You're asking about suicide for them. You're not asking about it for yourself. You want to ask them for them, not you. And knowing that when you ask, it's not going to make them think about doing it more. They might have a suicide attempt because I asked them.
Right.
And that is the largest misconception there is.
Big myth and damaging myth.
It is.
For sure. Anything else top of mind? One last thing you'd like to say?
Don't be fearful to talk to youth about this either. Talking to young teenagers and young adults, they're more resilient than you think. And I think we think they're fragile, and they're not. Be a gatekeeper for them. Maybe you are the person they needed to talk to.
Well, I think that brings it full circle. I mean, that's really what it's all about, I think, in many ways, is starting the conversation and not being afraid, as you say. Don't be afraid to have these conversations. It is trepidatious. It's fearful for us as clinicians, as just, folks walking around the world, to have these literally life or death conversations, but there's really nothing more important. So, thanks, Ethan. Appreciate you, man.
So many important things Ethan shared there. I'll close by highlighting one of the most important. People who attempt suicide don't really want to die. They want the pain to stop. They're trying to find a solution to the problem of their pain. Physical, mental, emotional, spiritual, financial, reputational pain. There are ways we can solve the problem of pain, or at least reduce it, or help folks develop whatever it takes to keep walking through the pain until a solution can be found. No feeling is final but hope.